Our question here says, the nurse is caring for a 6-month-old client who has bronchiolitis. It would be a priority for the nurse to monitor the client for what? So we need to know that bronchiolitis is caused by RSV. That's going to be really important here. And then also when a question says priority, we are looking for the most important, most necessary, most urgent option. We may have multiple options that we would want to do eventually, but we need to pick one, the most important. Option 1, it says it would be a priority for the nurse to monitor the client for decreased urine output. This is an incorrect option because it's not our priority. We do want to monitor for it. It's very important. A lot of times, our clients with RSV end up dehydrated. Our bottle intake goes down, and our sweet little babies, when their noses are all congested, right? We can't get any intake through a bottle. So we want to monitor for dehydration, and urine output's part of that, but it's not the highest priority right now. Option 2 says nasal flaring. This is going to be our correct answer. So nasal flaring indicates an increased work of breathing, especially in a 6-month-old client. We have impending respiratory failure here. So using our ABCs, right? Breathing is pretty important. This is going to be our priority. Option 3 says to monitor for changes in appetite. An incorrect option, but something we do want to monitor for. We kind of touched on that a little bit when we talked about option 1. Appetite is going to be decreased. Sometimes, PO intake may even be contraindicated depending on how bad our work of breathing is. So we do just want to monitor that as well. Make sure we're getting enough nutrition to help kind of fight off this virus. And then option 4 is a fever. And again, not a correct option, something we want to monitor for. Fever is kind of expected with RSV. We can administer antipyretics and those kind of things, but it's not going to be the priority. Our priority is definitely going to be breathing in this case. So we'll see y'all tomorrow.